The heart of the Myca Platform is a revolutionary new interface for doctors. Let Dr. J. Parkinson, Chief Medical Officer of Myca, guide you through its many features.
Hi there. I'm going to give you a tour of what it's like for a patient to make an appointment with me. They simply log in, tell me what's wrong, and choose a time. So if I'm a customer at Hello Health, I just log in. And this is what I see. I can see, my health history, my allergies, my immunizations, biomonitoring data. You can see my medications and see just all the different episodes of care that I've had. All of the medical information about you is accessible to you. But really what you want to do here is make an online appointment. So you need to tell us a reason, which is, in this case, sore throat. Answer a few questions. And then after this, based on the symptoms that you're having, sometimes, the only option available to you would be you can only see us in the office because, the symptoms that you're having mean that we really do need to physically examine you. So in this situation, though, I think I can see her over video. So I just click video. On Tuesday at 1:20 to 1:40, and then I'm done. That's it. Very simple, very easy. You come here to solve a problem, and we help you solve that problem. Now I'm going to give you a tour of the Myca Platform from the doctor side. When we were looking at other EMRs, we became very frustrated because the data wasn't in context. They were in lists and tabs and just unorganized. So we created a system that puts all points of data in the Myca Platform in context so that when you interact with the data, new data appears to answer who, what, when, where, and why. So let me show you. The first patient I need to see today is Jessica Price. This is Jessica. Her main problem is asthma, but I saw her for knee pain at one point. But now I just want to dive deeper into her asthma, figure out what's going on with her. So I click on it, and things pop up around it to put it in context. So I want to look and see, in 2008, how many visits does she have? So I can see in February she had plenty of visits, obviously an asthma exacerbation at the time. But she also had some notes, she also had some peak flows done, she also had some images, so she had a chest x-ray done, and that's, the impressions was, the finding was consistent with moderate asthma. So I can explore all of her x-rays within the system. Now, I also want to explore Jessica by her visit history. So I can click on this, and as I roll over, say, January 5th, things pop up below so that I can see that she had a visit for asthma, she was prescribed albuterol, her peak flow at the time was 84%, and she had a chest x-ray done. And I can also search Jessica Price by medications, and I see that, she's allergic to amoxicillin, but she's on albuterol. She's on Singulair as well for her asthma. The last time she was prescribed that was February 7th for a peak flow of 84%. I can also explore by numbers so that I can see, as I roll over information, for instance, that this CBC was gotten for pneumonia. She was prescribed Zithromax at the time, and there was a chest x-ray done. So really, today, Jessica, I'm seeing her in her home, and she already answered some questions so that the system thinks that she has asthma, probably a viral URI as well. So I can click on these to figure out, what were the responses to those questions that she answered that prompted our system to think that she had a viral URI that triggered her asthma. So I can click on it, but the next thing that pops up whenever I say next is their physical exam findings. And those physical exam findings support these diagnoses. So all I have to do is click on the physical exam findings that are present that support these diagnoses. And this is an intelligent backbone that we're using with the Myca Platform to just give me the physical exam findings that I need, not anything else relevant to other medical problems, because that's not what she's here for today. I can freely type in more physical exam findings and find others if I need to, But the whole point of this is to streamline documentation. So after I click Next, treatment protocols pop up that, that are designed specifically based on evidence-based medicine and current best practices, consensus opinion, expert opinion, that are the best treatments for the diagnosis. Now, this is if I'm seeing Jessica in the office or in her home. But what is it like whenever I'm seeing her via an IM? That's what it looks like. I can just type there. But I can also have a video conference with Jessica, and this is what it looks like. It just replaces the physical exam findings. But what's really great, all I have to do is say, you know, I want to follow up with Jessica in 4 days by video. Now, the other thing down here that's really great about our system is that there's a rating system for each treatment protocol so that doctors can rate treatment protocols so that they build consensus opinion within the Myca platform, because in the backbone of the Myca platform is artificial intelligence using multiple different modalities to create a system that learns the more you use it, both for doctors and for the whole platform of information. So all I do is after I'm done, you know, talking with Jessica, I just click Save, and it checks for drug interactions, it checks for allergies, it checks for the proper dosage, and whether or not there's any duplicated therapy. And didn't find any problems, so I said, okay, and it takes me back to the main screen. So that's the Myca platform. The whole point of this is to put information in context. It's a living, organic, kind of breathing interaction with data so that it's not giving you too much, but also allows you to dig deeper when you need to. You'll see the Myca interface in action in Hello Health. It's a new primary care practice we're opening in New York City this summer. Read our blog, visit our site to find out more about Myca, our platform, and Hello Health.